University of Montana students' mental health is impacted as the seasons change. Shorter stretches of sunlight, dropping temperatures, and midterm assignments are sources of stress and mental health decline. We talked with students and faculty about mental health on campus. The Curry Health Center offers healthcare services to UM students, including mental health care and wellness. The director of UM's Strategic Communications, Dave Kuntz, explains the differences between the two.
Wellness and counseling often have been looped together as one sort of nomenclature of services, but they're very different. The counseling services are there to serve students on a very confidential basis who need and are looking for services regarding mental health counseling. In terms of wellness, you'll see the university doing a lot of outward pushing of wellness, and wellness is more proactive activities and behaviors that can take place to ensure that the student body is healthy. There's tons of research that shows that increasing these wellness activities can help improve mental health, physical health, classroom performance, etc. And we have a great team that's led by Kaylee Julius over at the Curry Health Center that helps oversee these wellness efforts.
Kaylee Julius is the wellness director of Curry. Her sole focus has been the well-being of university students since starting work in 2009.
We do the National College Health Assessment Survey out of our office every 2 years, and we're able to kind of get some more solid data on kind of what the students' needs are. During, stressful times of the semester, so midterms and finals, we definitely see an uptick of students needing that support. Also in like January, February months where we have gray after gray after gray cold days, it really starts to take a toll.
Freshman student Lucia Petrich finds it hard to balance academic success and emotional well-being as days grow shorter and colder.
I try to do activities over the winter to prevent me from getting seasonal depression. I try to keep a busy schedule, but it is hard, and I'm going through it right now.
The wellness activities at Curry and around campus are free, but students must pay fees for one-on-one counseling. Student government members of ASUM failed to pass a plan to make counseling services free 2 years ago. Students' first counseling sessions are still free, but each appointment after costs $20. This is affordable compared to options outside of campus, yet many financially disadvantaged students still struggle to afford it. Kuntz expresses the administrative obstacles behind making Curry's counseling services more accessible.
Right now, there are financial challenges at Curry that have required in the past your first appointment for mental health counseling is free, but then after that, there is a small fee. So there's been lots of efforts that have been supported by the university, but ultimately, these are budget decisions, and we just have to figure out a way to pay for these services. The budget priorities are tough. The way the university allocates money happens in different ways. So we have the academic budget. What happens at Curry is similar to dining and housing and the rec centers. It's considered an auxiliary, and so the Curry Health Center doesn't get any financial support from the state government, from tuition dollars. It's all generated off of fees.
Second-year student Caesar Robles and many others fall into a common pattern during this time of closing themselves off emotionally and mentally.
It's easy to stay isolated, especially when it gets all gloomy outside, so I feel like the more friends you're able to reach out to, the more opportunity for activity.
Curry Health Center and other well-being programs on campus continue to promote their services, but financial and emotional barriers prevent students from seeking help. For the Montana Kaimin, I'm Katie McCumber.